Good morning, colleagues. Good morning, people who have joined this session. We are very happy that you could find the time to join us this morning in our panel discussion, which is going to focus on COVID-19 and healthcare financing. My name is Bruce Chirenga. I'm the chair of the scientific committee of the summit. I'm standing in for Professor Sewankambo, who is unable to chair this session. And I'm very happy for you who have taken time to attend this meeting. We know that the COVID-19 pandemic has affected almost all aspects of life, and looking for resources to finance healthcare is not spared. This has happened in high-income countries. Maybe, Amit, you can mute. You don't mind? Thank you. So this, the impact of COVID-19 on finding resources to finance healthcare has happened in high-income countries and low-income countries. But the impact could be greater in low-income countries, especially those of Africa, where we are seated now, because COVID-19 has affected the economies of these countries, but at the same time, it has affected the high-income countries, on which most of the low-income countries depended for additional funding of their national budgets. So we are very delighted this morning to have our panelists who are going to help us discuss the issue of healthcare financing and COVID. We have a total of 3 speakers. The first one is Fernando Anez, who is the Senior Health System Strategy Leader, Healthcare Funding and Financing at Roche. Fernando works at Roche in the Global Access Department, leading the global funding and financing strategy and implementation for Roche Pharma, including oncology, rare diseases, gene therapies, and genomic profile portfolio. In his role, he leads the strategic approach on innovative funding and affordability solutions, and coordinates the strategic alliances and partnerships with international financing players, bringing in public and private players, insurers, and other associations. He's a graduate of Buenos Aires University in Argentina, with a degree in administration and a master's in health economist and a pharmacoeconomist, and a master of public administration. Colleagues, join me in welcoming Fernando to make his presentation, and with that experience, you can really see that we expect to understand how we can overcome the shortages that we have in financing healthcare. Thank you.
Hi, Bruce. Hey, everyone. Can you hear me well? I'll share my screen. Tell me if you see it. Do you see it? Can anyone confirm, just to make sure?
You can see the screen.
Perfect. Thanks. First of all, thanks for the invitation. It's really a pleasure to be with you today. As it was said in the introduction, well, my name is Fernando Arnaiz, and I'm leading the funding and financing department in Roche Global Access. I'll explain to you, or I hope it's clear after my presentation, what we do in Roche, what a pharmaceutical company does to advance funding and financing solutions. But in a nutshell, we collaborate across public and private sector to develop and ideate and launch new ways to fund and finance access to innovation. So what I thought we could do in this next couple of minutes, I'll share some reflections on how we see the world post-COVID and how COVID might impact the healthcare funding and financing environment. And subsequently, I'll be sharing with you how we think the private sector can contribute and how has been Roche contributing to advance funding and financing solutions. I'll put a lot of emphasis on low and middle income countries. Although my role is global, many of the projects and solutions we are involved in are taking place in regions like Africa. So I'll put some emphasis on the low and middle income countries dynamics, and give you a couple of examples towards the end of my presentation. So basically, some of the reflections on how we are seeing the world, I thought of sharing with you first how the world pre-COVID looked like. I guess everyone would agree that there has been a sort of momentum around funding and financing based on these 4 boxes that I'm sharing with you right now. As a sort of like this description of the macro trends of the funding gaps. We knew that the funding gap for healthcare is huge, or was huge pre-COVID. And if you take a look at the projections from different sources like WHO or the World Bank, in the next 20 years, the gap, the funding gap for healthcare was going to grow. This brings or brought a lot of issues for different segments of the population. Something around 100 million people fell below the poverty line as a result of out-of-pocket healthcare spending. And that's one of the problems that this growing funding gap could bring. Secondly, and really importantly, I guess the other panelists also would agree that this is an era of official development assistance being declining. And we've been seeing this since 2014, where when it reached its peak. So there was a greater need for mobilization of domestic resources to close that also gap from ODA. And as kind of the last fourth macro trend, health systems, especially in LMICs, are clearly showing inefficiencies and inequities in health financing. There are different reports describing how big the inefficiencies were. So that's kind of the perspective of the world pre-COVID, and I thought of sharing with you, as I said, some thoughts on how we're seeing COVID impacting on healthcare financing and some notions of what can be done. This is just observations, and I'm representing a pharmaceutical company, so I'm not an academic person. I'll be happy to discuss any of these points with you today. On the front or side of how COVID could be impacting healthcare funding and financing, all the issues that I've just described will probably continue to exist in the subsequent years. And although it's really, really hard to forecast what is going to be the impact, I believe that the combined health and economic shocks triggered by COVID will have both direct and indirect consequences for health spending and progress. There is clearly a double shock. The health crisis is mirrored by a deep global economic crisis, and this will probably have a long-lasting impact on health financing. And due to the economic crisis, public revenues will probably continue to decline. And this might force many countries to take additional debt. So these are kind of the four C's that we see at the sort of high level on how COVID can impact healthcare financing. At the same time, I believe, excuse me, I believe that this is an opportunity for health systems to rethink their approach to sustainable financing. And if they start this process to rebuild their systems, there are many things that could be done differently. And I'm listing 6 points of what could be the policies that could be considered in the near future, such as secure domestic public spending on health as both as a societal and economic priority, and keep moving towards full financing for healthcare. I believe that there's a chance to reconsider new mechanisms for pooling funds managed by different global agencies. Regarding official development assistance, we believe that this will have to continue, but the modalities can be different, and there has to be some sort of combination of public funds and official development assistance. Governments can start institutionalizing expenditure tracking systems. There is a huge need for me to explore innovative funding models, and I'll refer to this in a couple of minutes and share some of the examples where we've been involved as Roche at the global and local level. And countries will for sure have to get serious about addressing waste and leakages. So that's the word pre-COVID, the impact of COVID-19 on healthcare financing, and some of the things that can be done. The last one here is where I'd like to put some additional, let's say, emphasis, and it's around public and private payers' contribution to strengthen health financing systems. And this is a role of the private sector and how the private sector can contribute. And since Roche is, of course, in that segment, that's where I'd like to put a bit more emphasis. We believe that the private sector is well positioned to contribute to UHC or universal health coverage efforts, and since it already provides health products and services for many million people and communities globally, it's well positioned to collaborate. The private sector in general can help create, adapt, apply, and scale up innovations, try to meet new business models that are aligned to universal health coverage goals at the local level. It can also be a source or a partner in supporting new funding and financing solutions. And also it can engage in, champion, and build capacities for relevant policy dialogue and partnerships with government and other stakeholders. I'd love to discuss more about this. These are 4 big elements that I think describe the potential role of the private sector in general. But what a pharmaceutical company can do, and the team that I lead is focused on working on the funding and financing solutions or angles that can be explored in cooperation with other stakeholders. So of course, the topic is COVID and healthcare funding and financing. I'll share with you some of the experience that we have in that area, and also some of the case studies that I mentioned I was going to cover. So you can have a fair representation of what can be done. This is one example. I hope there are many other private sector companies that are as committed as Roche in this area, and that there are more examples like this in the near future. So basically, the role of the private sector, our role in the healthcare funding and financing area is, as I told you, around collaborating or work collaboratively with governments and public authorities, private payers, intergovernmental organizations, non-governmental organizations, and private sector to do basically 2 things. One is to foster private funding, and the other one is to expand public funding. And we believe that the biggest value we bring to society is through our research and development, is the medication and healthcare solutions and interventions that we provide to society. But with no access, none of these things will make sense. And that's why we decided to embark in this area and created this team something like 10 years ago. And it was quite interesting because we realized that there were a lot of things to do in the space of healthcare funding and financing, but there was definitely not perhaps such a huge momentum as it is, or as we have right now post-COVID. So this is, we think is really going to be appreciated and needed by many health systems. So I'd like to walk you through what is innovative funding programs for us, how this could be deployed or used, and why we think this is going to be important in the near future in a world post-COVID. So as you know, the traditional funding models are mainly three: a government, out-of-pocket, and private insurance. But there's a broad range of rearrangements and new funding mechanisms that can be pulled to close the healthcare funding gap. And I'm listing here 8 big categories. There could probably be more of them, but the ones that we see has the highest potential are these 8. And they go from blended financing, where you have, for example, social impact bonds as one of the funding instruments that can be used to pull more funds into healthcare systems, different financial instruments like zero interest loans or different medical loans. We're seeing a lot of fundraising programs growing, as well as different donation programs. These are 2 that are going to be difficult to scale up, but they are there and they are a valid source. And on the second column, we have tech-enabled programs. Something that we are observing, especially in Africa, is the combination or the use of fintech platforms with mobile health wallets that can be combined with, for example, enhanced private insurance plans to offer top-up coverage to population in areas like cancer, for example. And the 2 last ones are novel reimbursement mechanisms. That's where you have managed entry agreements. It's a sort of solution that some governments use when they don't either have the funds or they don't have enough data around drug efficacy. And that's something that we're seeing is continuing to grow, as well as different patient access and support programs. So that's sort of like menu of the options that we're seeing in the space of healthcare funding innovation. These are the things that we see are going to be used in the near future to close funding gaps. And now I'll finish my presentation sharing some of the examples that can illustrate and give you more background of how this looks like in reality. And as I mentioned, the team that I lead and the things that Roche has been developing are around sustainable, scalable solutions that address specific funding access challenges that will become more and more important in a world post-COVID. And there's no one size fits all, unfortunately. So we've been working on around 40 countries. Some of them are in sub-Saharan Africa, for example, on trying to develop context-specific solutions with different partners, trying to combine different solutions to close funding gaps. And we've been using a range of the mechanisms that I just shared with you in the previous slide. In the last slide that I have to share with you today is the examples. So as I told you, you can learn more from how this lands and how this becomes a reality. And this is an outcome of good 5 years of work, and there's also a pipeline of different solutions that I think LMICs could consider in the near future. I'll start with Nigeria. We've been involved, Roche led a private sector coalition alongside the cooperation of the World Bank, IFC, that resulted into the establishment of the Nigerian Cancer Health Fund for standard of care cancer treatments. And this is a clear example of how private sector can contribute and work with governments to create funding and financing solutions that can help close that funding gap that we've mentioned. This was launched last year, law has been approved by the government, and now we're getting into implementation. And this is an example of cancer, right? But there are also other areas, like in Malaysia, we're involved in, it's a similar concept, a coalition of private sector partners. We're trying to mobilize funds for rare disease in Malaysia, and this is in development. In Dubai, we worked with other private sector stakeholders and the government of Dubai to create a central cancer fund that was implemented through a mandatory top-up insurance for all expatriates. That's 85% of the population, and it's roughly 3 million people. So this is a supplementary cancer policy that is there to complement the existing coverage provided by the government, and it's really affordable. This was launched in 2020 as well as a solution in Nigeria. And the last two are, one is Ghana, and this was 2019. We, in cooperation with Ghana's largest insurer nationwide, we developed the first affordable top-up breast cancer insurance product for formal and informal sectors. Also last year in Argentina, we developed, and I mentioned around fintech and mobile health wallets. We engaged in a partnership with Santander Bank to finance one of the genomic tests that is available in the market. And this is a combination of an e-commerce tool. It's an app that connects patients with different financing institutions, so they can have access to different tests and technologies. So with this, I'll finish. These are examples of how private sector can contribute and help advance some of these solutions. As I said, there are more things and more elements to bring into the discussion around how private sector can contribute to close funding gaps. And I'll be happy to discuss more of this with you. Thank you very much for your time, and I'll pass it again back to Bruce so we can continue with the session. Thank you.
Thank you very much for that wonderful presentation. So I want to inform our audience, please post your questions in the Q&A section, and after the presentations, we'll discuss them one by one. I want to introduce to you our next speaker, who is Dr. Amit Thacker, or Thacker. Dr. Amit is the executive chairman of the African, sorry, I forgot to put my video, of the African Health Business. He's also president of Africa Healthcare Foundation, chairman of the Kenya Healthcare Federation, and he currently serves as a director of Bumira DX and Gamina Limited, and he's also an active member of several organizations, charity organizations. He has received several awards including that one of Best CEO Award by the Titans Global in Business and Professional Service category in 2017. He has also received other awards from the Kenya Medical Association. Colleagues, join me in welcoming Dr. Amit to make his presentation. Thank you.
Thank you, Chair, and I do want to ask whether you can see my slide and I'm audible so that I can proceed.
Yes. I can see the slide and I can hear you very well. I hope
Let me
can hear you.
Let me first thank all the attendees, all the fellow panelists, and my previous presenter who set a good stage for the private sector. Let me also thank Professor Charles Ibingira. You are also with us in the panel room. Let me send you my warm greetings. I hope you can hear us clearly, Charles, and you are with us in the room. On behalf of the private sector and also on behalf of Africa Health Business in Africa, I want to congratulate the regional team in Kampala and Makerere University for setting up this wonderful summit that started off very well. At the opening ceremony, I took some incredible messages about the wake-up call that His Excellency, the President of Uganda, Yoweri Museveni, made a clarion call for people on Africa to wake up and seize this crisis as an opportunity and make sure we never ever repeat the same situation again where Africa is reliant on organizations and institutions and countries outside Africa for its well-being and health. Right now we are seeing an inequity that is a high example of an imbalance of global support, and this means we have to change the narrative. My presentation today on COVID-19 and health financing will feature a lot on what private sector and health investments in Africa should look like. About the AHB, which is a proud partner and the World Health Summit, we focus on the continent and work in several countries by organizing our work in consultancy and capital. And today's topic has got to do a lot with both consultancy and capital. On the AHB capital front, our interest and our work with our team is to enable multinationals from all over the world and local companies in Africa to increase its investments in the right manner, at the right space, in the right countries. Some of the key companies we work with to ensure we have a greater footprint in Africa are hospitals, clinics, pharmaceuticals, digital health companies, medical technology companies, distributors, and other individual investors. We have lately seen that private equity firms and investment firms are interested and are willing to increase its investment on the continent. What we need to do is to make an enabling environment through appropriate regulations and partnership to spur up this growth. Why is this necessary? It's very relevant to this discussion. It is only through increased investments and focus will we be able to make our own vaccines, our own medicines, our own PPEs, our own infection control products, our own tests and diagnostics, and have a higher number of service delivery companies, including hospitals and clinics, to look after the 1.3 billion people on the continent. You all know that HIV has been here with us for several years, over 15 years, and yet all the diagnostic tests for HIV are being imported from outside Africa, in Africa, to test the people on this continent. Why have we not done it? And a little bit, I would like to respond to His Excellency's message is that the health sector became lazy. It became lazy because imports from China and Europe, US, and other parts of the world were easy, and the supply chain and the logistics became quite easy to navigate. So, with the pandemic, when there was a shutdown of global supply chain, we realized the journey to self-sufficiency is important. We also got lazy by looking at the price being brought in was much cheaper than the price in building something up. So there was a short-term decision on let us continue importing before we set up our own manufacturing and our own supply chain. But the long-term gains are now very clear, and I think the pandemic will change the narrative on attracting investments in Africa. It's not that easy, it's a bit challenging. And some of the challenges are being dealt with by the statistics and the numbers that you now see on your screen. It's very clear that our consumer level will go up. UNECA estimates health business opportunities to be worth about 259 billion by 2033. So it's a sizable market. We all know that discussions in Africa has been always about the market size. But this is now significant for any multinational and any foreign investor to look at Africa seriously. It's the next big thing. And let's not forget the Continental Free Trade Agreement is going to be one major milestone on regulatory harmonization that will include all trade policies and programs and better investments. On this slide, you can see where we sit in the global scene. Of all the global private equity investments in healthcare, only 152 million came into Africa in 2019. It's a paltry sum. And you can see from the 78.9 billion. Now, what's been the trend? But the trend has been increasing over the last few years, and I think the pandemic is going to create another boost, and new investments required in healthcare assets to scale up health systems is about 30 billion that you can see. So if you look at 2018, 2019 and 2020, you can see that we have been increasing our percents, and these percents have been gradually going up by the PE deals, and this multiplier trend will help us get stronger investments. On this slide, you can see some examples that we would like to highlight and what's been happening in the scene around care provision, in supply logistics, in digital technologies. These are just a few examples that private equity companies have been engaging in Africa. Can we scale this up? Can we do something that will increase further investments, create more jobs, and even help the economy? We have been told by the SDG studies that for every dollar invested in healthcare, you actually get a return of over 5 times the dollar that you put in. To help us make it inclusive, our institution has engaged with the following 6 clients. Inclusivity means to have a robust partner ecosystem. And this is why our partnership with the World Health Summit, Makerere University, academia, is absolutely vital. So the level of engagement with government in Africa over the last decade in healthcare has transformed significantly. As the president of Africa Healthcare Federation, I can tell you the journey over the last 15 years, I have seen a change in leadership, I've seen a change in ownership and the dialogue between public and private. I believe that the trust level has been growing progressively, which leads us to a very strong foundation of public-private partnership. So with the government partnerships, and understanding how private sector works, this partner ecosystem creates the foundation on which we will build stronger investments in the health sector. And when we talk about inclusivity in Africa, it's clear that we need to bring the faith-based organizations, the civil society, and the NGOs onto the discussion table. Let's not also forget the role of development agencies. We do understand that donor funding is strong in the health sector in many countries. And if it's used effectively and adequately, it can spiral growth and have better health outputs, outcomes. What we need to do is to engage the development agencies so that there is efficiency and reduction of duplication and elimination of waste. And then finally, I think the two other partners I want to talk about is the global health institutions like WHO, Gavi, and all the other partners in the World Health Summit. I think they do a sterling job, and we want to be close to them in order to have appropriate solutions for this country and this continent. I've talked a lot about investments and private equity firms. I think they have a significant role. I've already shown you the numbers. I feel that the next decade for Africa is going to see a rise in the amount of investments that we see here. To end my presentation, I'd like to let the attendees and our partners know that we are specialists very deeply involved in business intelligence, capacity building, platform design and implementation. We're also very focused on network facilitation, which we've seen is a major bedrock in building a greater and a stronger health system. The fifth is money matters. So investment advisory. We've often been challenged, do we need more money for health or do we need more health in the money that we have? And the answer to that question is both. We do need to use our money more efficiently across the entire health system in Africa, reduce waste, reduce graft, and reduce inefficiencies. But we also need more investments, and the private sector needs to look at equity and bringing affordable healthcare to a wider number of citizens across the continent. And finally, together with many partners at the World Health Summit, we have a forum called Africa Health Business Symposium that spurs a high amount of partnership and grows the investments across the continent. So these are our solutions, and this is what we do in order to ensure that we have greater input in COVID-19 and financing. So, Mr. Chair, that was the end of my presentation. I am very delighted to let you know that on the vaccine front, we have, as a organization, worked with governments, and Kenya government being one. We have developed an MOU and a framework. This MOU and a framework came after 5 months of deep engagement of inclusive partners. This framework allows us to add onto the government imports of vaccines into the country. We will have the first trial in August. We made a call out to the private sector companies in Kenya who are willing to purchase vaccines from the government import sources. And we got a pledge from about 160 odd companies, and a pledge of 1 million vaccines at the rate of about $12 or $15. This shows that if public and private come together, the resources will double. So it will be twice faster for us to reach herd immunity and open up our economy in Africa. I believe that this trial in Kenya will be shared with East Africa and the whole of the continent. So rather than waiting for an entire 1.5 years to reach 30% coverage, I hope within a year we can reach the 60-70% coverage so that we can open up our economies so that we don't have a major divide between those who have and those who have not. We don't want to create a have and a have not economy in this world. So we need to rise up to the challenge, and private sector is playing its role to be on the forefront. Thank you very much. Let me hand it over back to the chair from here.
Thank you very much, Amit. That is a very wonderful presentation. I will invite other panelists who may have something to add. But before I do that, I will make a comment, 2 comments. The first one is about Amit's last presentation. He is looking into how the private sector, using their connections and using their experience in creating access, how they can be involved in access to vaccine doses. I think this is critical, and as academia, we may need to sit with the private sector and see what our contribution will be. In Uganda, there is one company which is trying to think in that direction. I chair their board, and they have brought up this issue of seeing how they can use their networks to make vaccine doses available. And I think that's a very important comment that you made. I would like to invite the panelists to comment on that. Secondly, for Fernando, your presentation on also innovations that you have to increase access to technologies. I wanted to know whether these have been already deployed in making sure that vaccine doses are available in Africa. But otherwise, I thank our panelists. I see Professor Ibinjira's system is open. You can make your comment. And then the panelists will come in.
Yeah, thank you, Chair Dr. Bruce, for the opportunity to be on this session of health financing. I think it is one of health financing is one of the key issues that governments, institutions, and individuals have to take care of in this situation of COVID. Of course, COVID came as a pandemic. So I'm very glad to participate in this session. But Chair, I would like to greet the participants out there and also to appreciate my fellow panelists in this session, particularly Dr. Amit from Africa Health Business. Thank you for partnering with us since 2018 when we started this struggle. Also, as the international president and the person specifically who has been specifically concerned with ensuring that this meeting happens, I would like to appreciate each and everyone who made a contribution and each and everyone who has participated in this meeting. I can't single out, but whoever made a contribution and whoever participated, we are so indebted to you as Makerere University, as the M8 Alliance, and the World Health Summit. Now, going back to the issue of health financing, of course, my colleagues have already talked a lot. Mine will just be to supplement on what they have said. First and foremost, health financing is now a very big priority to many governments, and not only governments, but even organizations, families, and individuals, because you'll find each and everyone in those compartments I've mentioned is affected, and because of COVID-19 outbreak. And this requires a lot of support in terms of the mindset at individual levels, and a lot of support in terms of policies if you are looking at governments and institutions at institutional levels in all those affected. Now, at the wake of this pandemic, WHO gave a big guidance on this, and it has been encouraging governments to focus on health systems resilience, health security, and universal health coverage. Countries should aim at raising adequate revenues for the health systems, which are terribly overstretched. And they should also have organized revenues to maximize the risk sharing across the populations in the best way to improve health and overcome COVID-19 and other diseases that those other diseases where you must continue spending. As you know, my background is in academia. I'm also a clinician, but I'm also involved in private sector and in healthcare. And you realize the biggest burden of spending in health at the moment is on human resource. You need adequate human resource who are well paid and who can actually stand the risk of care of COVID, to continue giving health care to the sick and continue encouraging the population to adhere to the standard operating procedures and to really take care of the population. But also you need to spend on consumables. These are a wide range. You also need equipment. I think this is where, for example, like in Uganda, we have been hard hit. If you look at the number of ICU beds, there are very few just because of lack of equipment. You also have to spend on communication because you have to keep communicating the messages. You have to keep in touch with each and every part of the health system. And you have to keep also communicating the outside world. You also have to spend on preventive facilities. These are quite many, including consumables, including health education, including vaccines, which have become a big issue. The inequalities, much as there is inequality, but still governments, especially from low and middle income countries, require funds to purchase enough vaccines for their population. Besides vaccines, you have to attend to all those who are already sick. And here you need drugs and other complementary support. Besides all that, COVID is a new disease. You have to spend on research. and I would like to appreciate government of Uganda through Preside. Some funds were put aside for funding research, but this has not been enough. I'm sure governments across the world are doing a lot on research. This requires some funding. You also have to spend on new industry. If you are planning to be self-reliant, to produce most of the consumables that are on high demand, produce vaccines, produce drugs, and so on and so forth. So, dear participants, I'm just highlighting a few issues where health financing is very, very essential. We also need to appreciate that COVID-19 is an epidemic. It came when nobody was prepared for it. So financing in this case is essential, is urgent. COVID-19 has affected nearly all sectors, and therefore you'll find that there is less money with patients, there is less money with governments, and even donor funding seem to be reducing. And therefore, there is also, at the height of COVID, there is need to maintain essential services, and these come at very high prices. In many countries, of course, the economies are affected, and business is less, and taxes are also less. But at the height of all that, you need to meet the health challenges brought about by COVID. So how do we maximize on health financing? I think governments, institutions, organizations, and individuals must address a number of issues, including addressing wastage and misappropriation of funds, so that these funds are put to a very good use and you have value for money. You also need to promote more resource mobilization at all levels, at the individual level, at government level, at donor level, so that you can generate enough funds which can be in turn used to cover funding the health system and all those other things I talked about earlier. Besides that, I think governments and even individuals must be very innovative to see how they can deepen and widen the resource base for health. For example, in Uganda, the insurance for healthcare this has been long debated. It's actually not existent. These days in hospitals, insurance companies don't want to fund COVID patients. I think it's timely now for governments to think about, especially our government, to think about bringing health insurance on board. And also health insurance should see how it comes in to support its clients who are on health insurance. But also there is need to prioritize the funds for health. There could be sectors in health which don't require a lot of funding. So there is a need for revising the budgets and looking at sectors which don't require a lot of funding and reportioning that money to make sure that you identify more money for health. And of course, I would like also to reiterate the fact that we need big cooperation and big support from the private sector. Dr. Meet has given a good example where the private sector in Kenya is being involved to to bring in vaccines. I think this should also happen. Of course, with a lot of care, government should make it liberal for the private sector to be involved. And this will help to share the burden of funding to make it easier for the population also to meet their demands. So fellow participants and fellow speakers, I thought I should add my voice by airing out a few of those issues. But to say that at government level, at individual level, there is a need to review and refocus the funding and to cut out wastages and to reprioritize the funds that are needed. But also there is a need to build self-reliance, generating enough resources, enough money from the various avenues of government, including tax, to make sure that this is put on financing health. And government should build sustainable ways of raising funds to meet such emergencies and issues in health which come when governments are unprepared. Chair, I think, allow me to end here and also to thank you for the opportunity, but also to thank our listeners and also my fellow speakers. Over to you, Chair.
Thank you so much, Professor Binjira, for that wonderful submission. So we have two questions in the chat, but I think Fernando and Amit could respond to the comments that I had raised. As I read out, go through the chat questions.
Yeah,
yes,
Chair.
Fernando?
Yeah, thanks. First of all, I'd like to share that I share everything that Professor Ivingira and Dr. Ahmed shared on the different concepts around bringing more money into healthcare, bringing more health into the money, how healthcare should be a priority, and the need to bring more funds and use it appropriately. I'd like to address probably first the second question from Ronald. Let me read it. The question is around how are the private players such as Roche and AHB contributing to health financing without competing with each other for working space. I'll answer that. Maybe we can discuss it also with Dr. Amit. I don't think we are competing. I think we're addressing more or less the same stakeholders, but from slightly different angles. And I think the solution for these type of discussions is not to compete, but to contribute and create an environment in which different private sector stakeholders can work together and contribute. In the case of Roche, as I said, we are working with governments at the national and provincial level, public authorities in general, private payers, intergovernmental and non-governmental organizations, and different type of coalitions. If I heard right, Dr. Amit shared something very similar. He mentioned around capability building. He mentioned also around plans to bring more private investment or yeah, private investment into healthcare. And those are things we're really advocating, we're exploring as well when we are brought to the table, and how and when we can collaborate. So I'd say no competition. We are addressing similar issues from different angles, and we are working and going to have to work with similar stakeholders. And the solution comes when we integrate thoughts and ideas and different models and deliver for the good of the entire population. So those are my thoughts on the second question. Maybe, I don't know if Dr. Amin, you want to complement.
Sure. Thanks, Fernando. Bruce, if I may respond and add to what Fernando has nicely framed, let me also thank Charles for his interventions, which were very spot on. My first comment, Fernando, when I saw this from Ronald Capesha, was competition is actually good. In fact, I believe that if there is no competition in Africa, we will literally erode healthcare gains. I am very supportive of competition, and what competition will do is it'll improve quality and reduce costs. Imagine if you had a monopoly of someone providing testing kits. And Fernando, you know what I mean by this. And it is a company like you who are leaders in the global space. And competition keeps you up on your feet. Look at the innovation Roche has done about its cobas, or the PCR testing. If we have more PCR tests and we have more equipment and we have more players, obviously it's going to impact on pricing. And I do want to also mention one thing here, and I really want us to be careful about this, is the area of open source and closed systems or proprietary systems. There is a very deliberate, dangerous situation where maybe many people in Africa are thinking we should be buying open source. Everything should be available for everyone. But there are certain things in healthcare which affects people's lives where proprietary matters. Now, IP, Bruce, as you know, has been shared, and everybody started clapping, and there was accolades because the IP on vaccine manufacturing was shared, which was a great thing. But that is not the end, and it's not the solution. To implement that and create and start having a fill and finish or manufacturing is a whole new process. So I personally want to tell everyone that competition is healthy, a healthy competition. What is not right is when there is disruption and there is models of favoring certain companies or certain individuals or certain institutions in the favor of others. So the leadership should actually promote competition, but should be focused on appropriateness of what and how tenders are being given. Tenderpreneurs in Africa are one of the champions in destroying healthcare. They are the ones who are wasting the largest amount of money. And if you see the tenderpreneurs and the amount of grafts that have happened, this is really ridiculous. And it's both sides, by the way. It takes two to tango, both the public and private. There is a private sector benefiting from that tender, which was illegally or unlawfully or inappropriately done, and then there is the public sector. That mix is the most dangerous that I believe has reduced healthcare on the continent. So competition, Fernando, I think is great. Everybody should have space. I believe that the collaboration between private sector has improved, Bruce, tremendously. I see private sector in Africa working together like never before. I see them sitting in a room together like never before. I see them exchanging information which is healthy, but they still want to increase their value, their share prices, and of course, the impact on health. Let me stop there.
Thank you so much. So we can also go to the next question from Katana. It says investment in research and innovation may be key to addressing inequity between low and middle income countries' access to health services. What strategy there is that private health investment organization will follow to bridge this gap. I don't know who wants to go first.
I'm happy to go first.
Yes.
Thank you, Bruce. And yeah, Katana, very good question. And I fully believe if you look at many documents of the government, Vision 2030, Vision 2040, Vision 2063 of Africa Union, research and development is being given a bigger funding and a larger space in the document, and rightly so. For many, many years, R&D was seen as a total waste of time and waste of money by many people in Treasury. So, will it address inequity? I totally think you're spot on. If research and development is a key area and innovation is a key area of investments, we will bridge the inequity. We will find that using a Toyota where a Rolls Royce is not needed will still get you from place A to B. Healthcare does not always need big, shiny machines. Sometimes a small digital app for women and having an ultrasound done will save more lives than to have maybe PET scans and MRIs. So, innovation and research is about getting the right technology at the right place, at the right price, for the right treatment. We often tend to look and say that if in Germany they have this much information and this is the equipment, we need all of those. We don't. In fact, Bruce, if you visit some of our hospitals, you might agree with me that sometimes you see graveyard of equipment lying at the back, and these are machines and equipments that have not been serviced, not been maintained, or it's not been managed, and they end up going to this graveyard at the back of the hospital. And that is all waste. You get sometimes machines in languages where our engineers don't understand, and they end up not being serviced, and they sit there taking space. So I think the question around research and innovation is so appropriate that once we use our resources appropriately, we can afford, we will afford the right type of interventions and technology and supplies that will produce better healthcare for the limited resources we have in Africa. And talking about clinical trials, talking about partnership, talking about having a foundation under which we will start creating a stronger public health system to deal with emergencies is actually a fundamental discussion where we should move from talk to action. You know how many forum we've been to where there's been so many discussions and you keep going around the same discussion. I hope that we are going to move from talk to action when it comes to setting up a manufacturing base, especially on vaccines in Africa. Maybe I turn it over to Fernando
Yeah.
to respond to this.
Thanks, Dr. Amit. Yeah, I fully agree with you. In fact, research and development for a company like Roche has been historically a top priority. Roche is amongst the top investors in healthcare, and many of the healthcare innovations in the space of cancer, for example, are coming from Roche, but also not only on the treatment sides, but diagnostics, we've been providing different solutions. And that's fueled by this commitment on investing on research and development. I'd like to address one point that you just mentioned. Innovation is meaningless if we don't ensure that patients have access to it, right? And that's part of what we've been discussing or alluding to. There are in many countries, in Africa, for example, an important part of the population not having access to what is the standard of care for example, cancer treatments in other countries in Europe or other regions, right? And I'd like to also underscore these efforts that Roche and also other pharmaceutical companies have been doing to ensure equitable access to these solutions. What we've been doing and what I just shared with you is it's one angle of what Roche is doing. This is on the funding front, but there are many areas in which we are working very, very hard to ensure that these innovations reach to the patients that really need them. I always try to share this with people I discuss this with. I wish we can all have this affordability mindset to ensure that we deploy solutions that are tailored to each health system in the way they need it, right? So that's part of what we've been doing over the last couple of years, is to reinforce these efforts through different access programs that make our innovation more affordable to the population, so everyone can reach to the medication or the treatment or the diagnostic platforms that are really needed. And sometimes you do it bilaterally with governments or different payers, and oftentimes you do it in collaboration and partnership with other partners from both public and private sector. So yeah, those are my thoughts on research and development. Continues to be a top priority, and access and affordability.
Yeah.
Thank you so much. Professor, you want to add?
Yes, thank you, Chair. I think I can add something on the private sector adding to, rather bridging the gap in research and innovation. And my take is that private sector, including the small ones, of course, the big ones like Roche and many others already have strategies as to how they are taking advantage of this situation. But I believe even the small ones need to identify their niches. I think the private sectors has players who have different niches. We have those in diagnostics, those in raw material, those in pharma, those in technology. And I think each of the private sector players can take advantage of their niches and see the gaps and quickly work to bridge these gaps within their line of action. There are also various players in the supply chain, which I think the private sector can get involved and maximize. Of course, for the smaller companies, at the beginning, I think it would be worthwhile to do public and private partnerships. I see, like here in Uganda, the private sector could, for example, partner with Makerere University in advancing research in those specific areas, because it is very difficult for a private company like in Uganda to garner the human resource, the high technically trained human resource. That is very easy for Roche because they have been doing that for a long time. But private sector in low and middle income countries, they can work with the public sector to take advantage of the already existing trained human resource to augment their research agendas to make sure they bridge the gaps that are left behind. So I think there is a role of partnership, but there is a role of also partnering with the big pharma. I don't know whether Fernando agrees that the big pharma through north to south cooperation can actually help to bridge these gaps. This has not been happening, and that's why we see great disparities in vaccine production. I'm sure if there had been that partnership, like I see, for example, in medical equipment, the big private sector players are coming down to partner with the local companies in the developing countries. But this is not happening much. There has been a lot of I don't want to use the word segregation, but monopoly, that everything is manufactured in the developed countries, is protected seriously, and down here, we only provide the market. But I think COVID has showed that we need to work together. And therefore, I would like to encourage the big private sector in developed world to partner with the small or upcoming private sector down here to build human capacity. And through the words of the German Chancellor, you are not alive, or you are not well until everyone is well. Because the diseases in health, they have no borders. You may think you are protecting your population, but diseases know borders, don't know borders, and therefore we should ensure that facilities which benefit healthcare, which promote good living and good health, are well spread across the world. And therefore, I would like to conclude by really encouraging big pharma. Yes, I know it's your monopoly, you are protecting millions and millions of dollars. But I'm sure when COVID came, many people in the developed world, those who had millions of dollars, they also perished. I think the most important thing we value here on earth is life. And life is not useful if you cannot share it. So I think that mentality of keeping monopolies, and I'm sorry, with due respect, I think facilities for health should be shared. You can monopolize maybe books or what, but things to do with health, I think the whole world needs to be reached, and therefore we need to encourage the small private sector in the low and middle income countries to partner with the big private sector in Europe, in America, in the Far East, so that we can actually take care of the health of the world population. Over to you, Chair.
Thank you very much, Professor, for those additions. We have a panelist called Lisa. Do you want to comment on something, or all is good? Otherwise, we have one more question in the chat. Lisa, over to you. Okay, as Lisa comes in, we have a comment. Actually, yeah. So Anna says, you've seen, Amit, you've seen the comment. But
I have seen.
The other attendees don't see the comment.
I have seen the comment. Anna Nisima is asking that it's intriguing there isn't much need for high-tech machinery in hospitals. If that is true, our leaders and those who can afford and have the money would be traveling to other countries for treatment. Take an example of cancer or heart complications. People here must sell their properties to travel for treatment. What is your comment on this? Good question. It's unfortunate that the poor people never have the rights, but I think the emphasis should be given on strengthening health systems in terms of health equipment, training, staff, etc. All human beings need quality health care, whether you are in Germany or Africa. Anna, good question. And maybe let me clarify. I meant when you have limited resources and you use all your resources to buy one dialysis machine, you can save one kidney patient. Or you use your resources to save 20,000 children who may be suffering from malaria. These are tough choices to make when resources are limited. Would you buy one dialysis machine or save 20,000 children? Whichever way you choose, you would have issues. I didn't mean that we should not progress and move up. I think we should. But the fact and the reality, Anna, is we cannot provide everything to everyone with the limited resources we have. And that is a fact. We can't do it today. And I do agree with you, we should have Germany and Africa the same. Germany spends $5,000 per person per year on healthcare. That is the healthcare expenditure. In East Africa, where we are hardly spending $75. USA spends $10,000 per person per year on healthcare. It is very stark difference. However, we can produce healthcare with the limited resources we have. It is a journey, and we should try and make sure that people don't have to fly for specialized care. But unfortunately, in the short term, it is going to remain, and in the long term, we need the specialists in Africa. It's a progress. It's a good question, but that's my response.
Chair, can I?
Colleagues, okay, Professor, in 1 minute. Professor, go ahead. You may be muted.
Thank you, Nisima, for this question. It is related to what has been intriguing us, the inequality in distributing vaccines. But Nisima, you need to know that for quite a long time, even before COVID, there has been great health disparities. Healthcare, the biggest amounts of money in healthcare are in a small population in the Western, in the rich countries, whereas here in Africa and other low and middle income countries, we have limited resources for health. At the same time, also the resources for research for healthcare are greater in the rich countries where 20% of the population live, and they are very scarce in low and middle income countries. My take here is that our governments need to wake up, like our president said. We have to use the few resources that we have to make sure we stop dependency and we build our health systems. And this will stop, and we allocate money for research. I know in Uganda, we have been depending for research funding from money from outside. But recently, the government woke up and is providing some money for some research. Now, if we can continue on that trend, I know we can build the health systems through universal health, promote universal health coverage so that people can access quality health care wherever they are at an affordable price, and this is what we should, this is the agenda, the priority agenda that should be driven by our ministries of health. Increasing budgetary funding for health and for the health system so that we stop dependency. But also, as I mentioned earlier, I think the developed countries should also reconsider their agendas and strategies and really come down to protect the human race, because all life matters. Thank you, Chair, and thank you, listeners.
Thank you very much, Professor Regina. Our panelists and our audience, I want to thank you so much. You've been such a wonderful group. Our time is up. Have a good afternoon and lunch.